Growth plate fractures in children are commonly classified using the Salter-Harris classification. This system is important because it helps predict prognosis, the risk of growth disturbance, and guides treatment decisions. In children, long bones contain a specialized cartilaginous structure known as the physis or growth plate. The physis lies between the metaphysis and the epiphysis and is responsible for longitudinal bone growth. However, because it is structurally weaker than the surrounding bone and ligaments, it is particularly vulnerable to injury. The Salter-Harris classification describes how a fracture line passes through the metaphysis, physis, and epiphysis, and it divides physeal injuries into 5 main types. Type 1 fractures pass directly through the physis, separating the epiphysis from the metaphysis without involving bone on either side. These injuries are often seen in younger children and usually have a good prognosis because the germinal layer of the growth plate is typically preserved. Type 2 fractures pass through the physis and extend into the metaphysis. This is the most common type of Salter-Harris fracture, accounting for approximately 70 to 75% of physeal injuries. A characteristic triangular fragment of metaphyseal bone may be present, known as the Thurston-Holland fragment. Type 3 fractures pass through the physis and extend into the epiphysis, reaching the articular surface. Because these fractures involve the joint, accurate anatomical reduction is important to restore joint congruity and prevent future complications such as early degenerative changes. Type 4 fractures extend through the metaphysis, physis, and epiphysis, crossing the entire growth plate and involving the joint surface. These injuries disrupt both the articular surface and the growth plate, and therefore precise anatomical reduction, often with surgical fixation, is usually required to minimize the risk of growth disturbance. Type 5 injuries represent a crush injury to the physis. In this type, the growth plate is compressed rather than fractured. These injuries can be difficult to detect on initial radiographs and are sometimes diagnosed later when growth arrest or angular deformity becomes apparent. Among the Salter-Harris injuries, type 5 has the highest risk of permanent growth disturbance. A useful way to remember the Salter-Harris classification is the mnemonic SALTER. S stands for slip, which corresponds to type 1. A stands for above the physis, corresponding to type 2 fractures involving the metaphysis. L stands for lower than the physis, referring to type 3 fractures involving the epiphysis. T stands for through the metaphysis, physis, and epiphysis, which describes type 4 injuries. Finally, R stands for rammed, representing the crush injuries seen in type 5 fractures. Understanding the Salter-Harris classification is essential in orthopedics because early recognition of physeal injuries helps guide appropriate treatment and reduces the risk of long-term complications such as growth arrest, limb length discrepancy, or angular deformity.